and we have colleagues near from 20 different countries. I really get very honored to have this information. And from a local company, from Ankara, I'm really proud of it. And maybe in the morning you hear a lot about osteopathies and other physical therapy exercises, but maybe you can be thinking about that. What about this cardiovascular surgery is here? So I think it will be a new era that I will mention today, especially if we will publish our results soon. Now the shockwave therapy, I think, will have a new indication in the field. So let me show you my experience, what we did so far, and how we came to this idea that we should implement shockwave therapy in lipedema treatment. And I will start. What is a lipedema? Actually, lipedema, as you will see, that it's a connective tissue disorder, mainly affecting the fat tissue, but it is not only a simple fat. So there is some inflammatory reactions which happens at the fat tissue, and then those ladies mostly has been, let's say, confused with simple obese patients, but unfortunately these are not obese people. So this is something different that we have to deal with. And as you will see that it's a chronic condition, which is currently thought to be a progressive as well. And it is not that, let's say, seldom. Nearly, if all the female population, it has nearly 10% incidence. So it's a huge amount. If you think about that, for example, Ankara is nearly an 8 million population. And if you think that, especially for the people more than 15 years old, there will be, maybe if you accept 3 million, and when you make it 10%, we have huge amounts of lipedema patients globally. So there is a huge patient group that need to be treated with those, let's say, systems. And trigger for development of lipedema is increase in the fluid and lipedema accumulation, which is mainly, especially related with the estrogen levels increase. And that's why the disease starts with the first start of menstrual cycles in the, let's say, teenage period. Especially, that's because of its dedicated to the female population, which is rarely seen in men, especially with very obese men. But it's some, let's say, only case reports. After that, especially every pregnancy, with the pregnancy increases of the estrogen levels, the disease progresses a little more. And with the menopause situation, and it comes to a definitive era. And actually, if those patients are using some oral contraceptives, and also if they have some, for example, let's say, childbearing therapies, then those patients also has a tendency to increase to have such type of lipedema problem. And it was first described in 1940 at Medikal and also simultaneously in Germany as well. And after that, unfortunately, it is mostly focused with lymphedema. Of course, I will show you how we can differentiate them. And also simple obesity. So many of those patients, unfortunately, are underdiagnosed, and then that's because of it, they are undertreated. And many of them, when we have the diagnosis, has advanced stages. And just because of that, those patients sometimes feel desperate. And also, since many of those patients also has been confused because they are fat people, obese people, they started making some, let's say, different type of dietary regimens which doesn't have that. Mostly they give weight at the upper body, but the lower body, the edema stays. So those people, that's because of it, also has some kind of chronic disease depression. So we also need those patients also help in a psychological way as well. But we can treat those people, so we can reduce their pain and edema, especially shockwave therapy is really efficient in treating the pain related with lipedema. Those pain is really resistant to any medication. So this is a, let's say, dull pain, especially which happens at the night. Mostly they can be mixed with, let's say, restless leg syndrome, unfortunately. But those therapies, especially the neuropathic therapy, doesn't help them. So those medications doesn't loosen their pains. So if I come to the diagnosis is actually very simple. We doesn't need any, let's say, diagnostic tools. Only physical examination is enough to diagnose those patients. And it has some classifications and grading system as well. Here, I will mention them about, but especially to have some diagnostic tools, I want to mention on these tables. Actually, history is important because there is an autosomal dominant hereditary, let's say, inheritance of this pathology. So it means that if there is a lipedema mother, maybe 100% her daughter will have a lipedema, unless the daughter is not inherited by some, let's say, genes from her father. That's why it will continuously goes every siblings. And begins at the times of hormone, as I told before, and difficulty losing lipedema tissue, especially from the links. And if you look at the physical exam, disproportionately increased, especially loose connective tissue, and it is symmetric. So if there is an asymmetry, most of the time there should be an accompanying venous problem like varicose vein or some other pathologies. And you can feel that palpable nodules, and especially the diameters of the nodules increase with the advanced stage of the pathology. And these are painful. You know, sometimes if you see many people ladies around, when you touch simply, they feel pain, and when you think that, oh, how come such a simple touch may not create pain? But yes, it is. Those patients will have especially a lot of pain even with a simple touch. And lower abdominal part can be affected, and also limb swelling, pitting, and non-pitting edema can happen, but undiscriminated factor, hands and the foot do not include with this pathology. So this is a discrimination factor with the lipedema. So you know that lipedema mostly affect hands and feet. And as a comorbid factors, you will see that they have hypermobile joints. They have loss of tissue elasticity, and lipedema can sometimes, let's say, accompany, especially at stage 3 patients. And non-lipedema obesity can happen because they can be also obese because of the, let's say, wrong dietary habits, and they can also have metabolic disease in later stages. And one of the important issues, they can have easy bruising. They feel it. Sometimes they say that even they didn't hit anywhere, but they have some spontaneous ecchymosis on their legs. And if you look at the staging of the pathology, as you see that starting from stage 1 to stage 3, how the edematous tissue, especially ligaments tissue, increase. And it has some types as well. In type 1, there can be only lipid accumulation on the buttocks, and then in type 2, the thigh region is affected, and in type 3, all the leg is affected, and type 4 is the upper arm lipid accumulation, and type 5 below the knee. And if there is also, you get these signs, especially since the feet is not never affected, it stays at the ankle, and you will see that some overhanging, especially at the level of ankle. And you see that how it is accumulated in the upper arm as well. I don't want to go into detail because these are some, let's say, physiopathologic issues, and I don't want to bore you, but I just want to come to topic why I think that we should use especially shockwave therapy in lipedema. You see that we have a fibrosis of the lower loose connective tissue, and in lipedema it inhibits the weight loss by usual measures. So we need to do something else other than the dietary or physical therapies. In this study, you will see that especially as a regular measure, not study. We apply dietary regulation, physical activity, manual therapies, pneumatic compression pumps, but these are not helpful, especially for the already accumulated fibrotic edematous tissues. So I tried to add the shockwave therapy over all these measurements. So actually, this what I want to show you this one, because lipedema tissue should be mobilized deeper with myofascial release. When I read this, I think that we need some device, and I adjusted especially physical therapy devices, and then I notified them there is a shockwave therapy that I can implement this therapy to the lipedema. And then I came to myself to Inceler Medikal because it's an Ankara company, I really am proud of it. I bought the device from them. And then after I bought the device, they come to me because I'm a cardiovascular surgeon, not in the indication list. They asked me what indication you will use it, and then I explained them. So I planning to use this device and the lipedema treatment. So they also got very interested because this is something different that's not in the let's say indication list. So we started with the radial let's say shockwave therapy before. But after that, because we have, as you see, that grade 3 patients, they are really thick. Radial, yes, it is also effective. I have the first results also with the radial therapy. But after that, we started our treatment protocol with the focus therapy. Of course, focus is more affecting deep, and then we have good results with the focus therapy as well. So I will present now the first 26 cases of the focus therapy with you. As you see, we included 26 women, and then we applied the, let's say, shockwave therapy as a combination of manual therapy, pneumatic compression device, and some dietary and physical exercise regulations. Yes, as you see, we use the focus therapy from the Inceler Medikal. You see that, especially in one session, because these are huge legs, especially in one session, we are applying actually 6,000 shock pulses to the region. And as you will see that in the thigh region and in the leg region, especially in density is different because of the fat tissue density. And after that, we put them following the physical therapy to the pneumatic compression devices for half an hour. And then we apply them some recommendations, walking 30 to 60 minutes and creating a diet suitable for lipedema with the help of a dietitian. And we apply them some compression stockings as well. And here you see the results of the patients. Especially we are measuring them at 3 different levels: ankle, below the knee 10 centimeters, and above the knee 10 centimeters. And every patient with the see that you see how we measure them before and after the treatment. And don't just mix with those tables. So here you will see that these are the mean diameters of the patients, ankle, below the knee, and thigh. And statistically, all those patients after 10 sessions dramatically showed decrease in fat tissues, and they really, without pain, especially, this is really dramatic, because after the, you can believe that after 2 or 3 sessions, pain related with the lipedema is totally disappear, and those people are really happy to get rid of such type of pain. And after that, if we continue on the treatment protocol, they begin to decrease in size. And then they are really happy because these are huge legs, very heavy, difficult to walk, difficult to mobilize. But when you decrease them, especially, at least in most of the time, especially 10 sessions, we are having regularly 4 to 5 centimeters decrease in the treated areas. So here you will see that how bulk lesions also coming to decrease, and how you see that in 10 sessions we are having good results. According to the results of our study and the treatment protocol, which we applied with shockwave therapy, pneumatic compression and recommendations, these are really effective, reliable, and can be used in the treatment of lipedema. Thank you for listening. And actually, we got an let's say, award at the European Nephrology meeting at the end of May this year. Our 2 presentations get 2 different, let's say, best presentations presentation is award in the European Nephrology meeting in Istanbul this year. And together with my physical therapy, autism is also sitting among the audience. Actually, we are proud of it.